Okay, good morning everyone. This is Dr. Murali Chand from India. Now I will tell you how to eliminate fear factor of sphenoid sinus. How to eliminate fear factor when you are doing sphenoidal pathology. See, when you enter into the sphenoid, the first thing you have to look at is LOCR. LOCR are baby's eyes. Baby's eyes. LOCR are baby's eyes. So, after removing the keel of the sphenoid, the first thing you have to look is LOCR, that is baby's eyes. Now, these eyebrows are optic nerves. These eyebrows are optic nerves. These eyebrows are optic nerves. Eyes are LOCR. And cheeks are paracellular carotids, like this. Paracellular carotids. Mouth and this one, nose, are pituitary. So for the first thing, after removing the sphenoid keel, you have to look at baby's eyes. This description is not my own description. It is described by a great anatomist of America. So, in any pathology, once you enter the sphenoid sinus, you have to look at the baby's eyes. That is LOCRs, lateral optico-carotid recess. This is optic nerve. This cheek is paracellular carotid. So, like we see the baby's eye, when we see a baby, immediately after entering the sphenoid, we have to see the LOCRs. So, those are the risk zones. So, we can protect the carotid and the optic nerves. So, in sphenoidal pathology, in extensive polyposis, keep a pack, adrenal pack, and wait for some time, and then remove with Blakesley forceps. Never use debrider. Suppose in fungal sinusitis, stay in the midline. Stay in the midline. How to identify the midline in the sphenoid sinus? Your nasal septum is the indicator of midline. Never consider the sphenoidal septum. Sphenoidal septum may be attached to the right or left paracellular carotid. Never consider your sphenoidal septum as your midline. So, always consider the posterior end of the septum as midline and clear the pathology in the midline and then only go for lateral. So, in fungal sinusitis, clear the midline pathology and then with suction, bulb tip suction or with rubber tip suction, suck the lateral end. Okay. So, once again I am repeating. So, once you remove the sphenoidal keel, like we see when we see a baby, we see the baby's eyes. Similarly, we have to see the LOCRs. Eyes, baby's eyes are LOCR, lateral optico-carotid recesses. So, optic nerve is eyebrow. Cheek is paracellular carotid. Mouth and nose are pituitary. So, eye is optico-carotid recess. Okay. Thank you. Sometimes you don't find LOCRs in the sphenoid. That is, you cannot see the eyes in the LOCR in less pneumatized sphenoid cavities. Sometimes one LOCR is not seen, sometimes both LOCR are not seen. In such a situation, the important drilling exercise is drilling the planum. This is forehead is the planum. The drilling the forehead, drilling the planum. This here forehead is the planum. So, drill the planum and identify the optic nerves. In that way, you get an important landmark of optic nerve. So, when you don't find the LOCR, stay in the midline and remove the pathology in polyposis or fungal sinusitis. In osteomas, when you don't find LOCRs, when you cannot see the eyes of a baby, drill the planum, identify the optic nerve, and then you will get an important landmark, that is the optic nerve. Then you can anticipate just below that, that is the cheek of the baby, as paracellular carotid. So this exercise is useful in osteomas, where you cannot find the LOCRs, drilling the planum. Okay, thank you.